Hi guys, this is Alex from Salmonella Place. Right now I'm going to give you a pharmacology lecture on the gastrointestinal tract. This is the first of several because it's a really large topic and I just wanted to break it down into some smaller topics so it's easier for you to study and look for in the playlists. So right now I'm going to talk about the inhibition of acid reflux and mucosal protection agents. I'm going to run through the basics of the neuronal control of the GI tract, explain to you about peptic ulcers, and then go on to the drug groups. So basically, the neuronal control is a lot simpler than it may look like in the books. Basically, you have the parasympathetic and sympathetic fibers, in which you can find the neurotransmitters, and you have hormonal control. So, the parasympathetic fibers stem from the vagus nerve, which is cranial nerve number 10, and you can find them in the myenteric and submucosal plexuses. The sympathetic fibers are found in the smooth muscle of the vessels and the GI cells. Now, the neurotransmitters, which are in the fibers, include acetylcholine, norepinephrine, purines, serotonin, nitric oxide, and various peptides. And the hormones, which can be endocrine or paracrine, the endocrine include gastrin and the paracrine histamine. So that's just the basics of the basics into what governs bowel movements and release of different substances. Now, the main point of this lecture is peptic ulcers, how to prevent them, how to treat them. Now, a peptic ulcer usually develops in the gastric or the duodenal mucosa, and it depends on the aggressive and defensive factors. Now, they are there always. It's almost like the microflora of the mouth. And when that gets out of balance, then you'll get an infection or a cavity. So it's the same with the stomach. If these factors get out of balance, then you will probably get a peptic ulcer. Now, the aggressive factors include gastric acid, pepsin, Helicobacter pylori, and decreased circulation to the area. Whereas the defensive factors include mucus secretion, bicarbonate ion release from the epithelial cells, and vasodilation. So they're constantly combating each other in a balance. Now, the therapy would be to increase the defensive factors and decrease the aggressive factors. I just want to mention as well, there are some syndromes, for example, reflux esophagitis, otherwise known as GERD, and Zollinger-Ellison syndrome, which are conditions that are related to increased gastric acid secretion. And as part of these syndromes, you may experience the fact that a peptic ulcer will present at some point in time. So now I'm going to go on to the drug groups, and I'm going to divide them into two sections: the acid reflux and the mucosal protective agents. So the ones that fall into the acid reflux category include antacids, such as aluminium trihydrate, which when it gets to the stomach, it forms the complex aluminium chloride or trichloride. And they have the side effects of constipation and hypophosphatemia. Then you have magnesium dihydroxide, which forms magnesium chloride in the stomach, causing diarrhea and hypermanganesemia. And then you have ALMA, ALMA, which is a combination of two drugs which overcomes the GI disturbance. And this can be given with either of the first two compounds. Then you have the histamine 2 receptor antagonists, cimetidine and ranitidine. Ranitidine has the side effect of hepatotoxicity. Cimetidine causes feminization due to the P450. And then the last group are the proton pump inhibitors. omeprazole, pantoprazole, lansoprazole. These inhibit the hydrogen potassium ATPase, which is stimulated and causes gastric acid secretion. These are inactive at a neutral pH. I'm talking about the drugs now, not the ATPase. And they are weak bases which accumulate in the parietal cells in the canaliculi. They are injected per os, and they are enterically coated, so they have a long half-life of up to 2 to 3 days. Their side effects include diarrhea and headache. Now, still on the inhibitors of acid reflux, I'd like to mention atropine-like drugs, including atropine itself and pirenzepine, which is a muscarinic receptor antagonist, M1, and they inhibit gastric acid secretion and relieve the spasms around the ulcer. Now, the last, it's a combination, this group. The last group I want to talk about is actually the ones that treat Helicobacter pylori manifestation. And this is omeprazole with amoxicillin or clarithromycin, depending, with metronidazole, and finally bismuth chelates. And now I'm going to go on to the other group, mucosal protective drugs. So first, bismuth chelate. This is a colloidal bismuth. It's toxic to the Helicobacter pylori, and as I mentioned previously, it is used in the therapy of a manifestation of Helicobacter pylori. And it is toxic because it inhibits the adhesion of the Helicobacter pylori to the mucosa, because it coats the base of the ulcer and absorbs pepsin. It increases prostaglandin synthesis and the release of bicarbonate ion. However, it does have the side effects of nausea, vomiting, and it can create a black tongue and feces. The next is sucralfate, which is sucrose and aluminium sulfate. It releases aluminium when the acid is present, and it forms a complex gel with the mucus, which decreases its degradation by pepsin. It limits the hydrogen ion diffusion and stimulates mucus and bicarbonate ion and prostaglandin synthesis. It's given per os, and it's long-lasting, up to 3 hours. However, it can cause drug interactions. It decreases the absorption of fluoroquinolones, theophylline, and digoxin. Its side effects include constipation and vomiting. Lastly, misoprostol, which is a stable prostaglandin E1 analog. It inhibits gastric acid secretion to food and histamine, and it increases the mucosal blood flow and increases the release of mucus and bicarbonate ion. It's given with NSAIDs for prophylaxis, and it can cause diarrhea, abdominal cramps, and uterine contractions. So that's the end of this topic. If you would like to see more on the GI tract, please check my pharmacology lecture playlist on YouTube or go to our website www.salmonellaplace.com. If you have any questions or comments, please leave them below this video and I'll get back to you as soon as I can. So enjoy studying and check out the rest of my lectures.